Good afternoon. Welcome from San Antonio. Got a special program today. It's Fresh Start Surgical Gifts. Wonderful program, which we're going to hear more about. Before we get started, some housekeeping things. This is a presentation from the San Antonio Coalition of Veterans and Families. Our mission, the immediate assistance for homeless vets in the San Antonio area. Please feel free to hit the like button and subscribe to our channel. It means a great deal to us. Our guest speaker today, Angela Paduch, an RN. About Fresh Start, this is from their website. Amazing program, disadvantaged infants, children, and teens with physical and cosmetic deformities. They provide reconstructive plastic surgery at no cost to the patients or the family. Again, an amazing program, and we're going to hear more about it. For contact information, in San Diego, I have the information on the left, but of course we have Angela here, so there's a local contact. And if you want to see more, we'll provide the link in the description. Of course, that's the QR code.
It's just freshstart.org is our website.
Yeah, we'll put that in so people can get it. And without further ado, Angela, what an interesting program. How did
Yes.
you get into this?
Well, it actually kind of came to me. I was working as a nurse here in the recovery room at one of the local hospitals, and I had a resume up on Indeed, and I got this thing saying, "Hey, would you be interested in applying for this job here? We're opening up a branch here in San Antonio, and we need a nurse here to help coordinate things." So I applied, and 3 years later, here I am.
Wonderful. And a good plug for Indeed. If I were still working,
Yes.
uh, how long have you been doing this?
Well, I've been a nurse for 35 years, but I've been working for Fresh Start for 3 years.
Yeah,
And my
and
background is, operating room, recovery, and pre-op. And then I've done some endoscopy, I've done a little cath lab, I've been all over the, surgical kind of stuff.
and I know you're working hard to make the program better known. How I know that is that's how I heard about it through one of your outreach efforts. So wonderful. Can you tell us a little bit more about the program?
So, like I said in that one slide you showed, we provide free cosmetic and reconstructive surgeries to kids and young adults from like birth to age 20. What we're here is to give a kid a fresh start. If there's something about themselves that they don't like, that they feel self conscious about, that they're teased about, that makes them feel less than, that's something we can help with, perhaps. Um, Things like people's ears sticking out, or boys that have breast tissue, or girls that have overdeveloped breast, or their nose is disfigured, or they have scars. There's a multitude of things that kids get teased about. So what we can do is come in and fix those problems, hopefully, and then give the kid a better chance at a better tomorrow. Um, and that's our whole mission, is just to make kids have a better life so they can be better in the future.
Now, who's providing services?
Well, here in San Antonio, we work with University Hospital and their physicians. So we have some of the best, top-notch people in San Antonio that are working on people. In San Diego, they have surgeons. They work with Rady's Children's Hospital, but they have volunteers from all over San Diego and different parts of California, actually, that come and help provide the surgeries to the kids out there.
Now, because it's the internet, because we're posting this on the internet, there's possibilities of people not from the immediate San Antonio area seeing this. Can they
Anybody,
still contact?
anybody in the country can apply. We get a lot of kids from outside of the country. And that's kind of what we're kind of pushing to kind of get more kids here from America, because we know that they're here and we know that there's a need, but it's it's just getting the word to the people so they know we're here and what we're doing. A lot of people have never heard of us. So that's a big problem as well.
How does the process go?
So if you have a child and you think there's something that we could help with, you would go to our website and there's an application. You click on the link and it would take you to an application. Our application is pretty simple. We ask a few basic questions. Um, and then it would go to the main office in San Diego. And then if it was kind of local, it would come to me and I would start going over it and see what we would need to do. Um, our thing is we kind of pick up where insurance and Medicaid leave off. So if you have insurance or Medicaid, that's not a problem. But it is a problem when insurance or Medicaid goes, no, we're not going to cover this procedure. And that happens a lot. Like the ear sticking out, they say it's a cosmetic procedure, they're not going to cover it. So even if you make a nice living, you make 60,000, you don't have $25,000 to pay for an elective surgery for your child. And that's where we can come in and help.
So if you walk me through this, like you got a referral today or an application today, kind of time out the process for me.
So, like I said, if it was local, it would come to me. I'd start working on it. I'd contact the family and say, okay, what's your need? What are we looking at? Have you been denied by your insurance, or do you have insurance or Medicaid? And so then we would need a denial if they didn't have insurance. But there's a whole thing behind that. But we would look at that. Would be because we would like to, if Medicaid can pay for it, we would
Sure,
prefer it that way. But
sure.
that's where we come in is when Medicaid and insurance won't pay for it. And then I would refer this, I would talk to we have a medical director here in San Antonio, Dr. Richard Thompson. He's a pediatric plastic surgeon. And I would say, hey, I've got this patient. You think that's something we can help with? Is it something you can do, or do we need to find another surgeon? We've got a whole hospital full of surgeons that are willing to help us. So he would either help us find a surgeon or he would maybe be willing to do it himself. And then we would work on planning it out. The patient has to be presented in our medical program committee, and they get approved by other healthcare providers, doctors and nurses. It's not just us making the decisions. So it's not just me going, okay, yeah, I'm going to pick you. And we have to run everything by our medical committee.
Okay. Unfortunately, a lot of people in Texas statistically don't have any health care.
Mm-hmm.
Is that an issue when they apply?
No, I mean, it's really not. If they don't have an insurance, then we would ask them to apply for Medicaid, um, to see if they qualify. And some people don't qualify for Medicaid
Sure.
just because we've had patients like that where they have insurance, um, or they don't have insurance and they apply for Medicaid, but they make too much money for Medicaid, but they don't make enough money to afford insurance. That's
Yeah.
the dichotomy of this really weird healthcare system that we live in is, you know, and I wish I knew a better way to fix it, but that's kind of where we're at. It's like, oh, you make too much money, but you don't make enough money to afford. So then you're stuck in the middle where you don't have anything.
And though the paperwork can sound overwhelming, I get the feeling that you're talking them through exactly what
Yes.
they need to do.
And
So
the
that,
paperwork really isn't that overwhelming. It really isn't.
yeah,
If you go and look at our application, it's pretty simple. And then I would ask for things like medical records, birth certificates, um, just general things like that. Nothing, everything, things that they should have.
so there's help navigating this whole
Oh
process.
yeah, I'm not going to just go, hey, here you go. No, I will be with you every step of the way.
Wonderful. Um, just asking, and of course, the hope is you always do more. In a given year, how many cases have you
Well, it
done?
just kind of depends. Like last physical year, which ends in June, so far I think we've done 17 surgeries since last July.
That's amazing. Okay,
So, and then they do a lot more in California because they do surgeries every other month, pretty much there. Here, we're only doing it 4 times a year right now, but because the program just hasn't been very busy. Eventually, yeah, we'd like to move it up to more times a year once we get busier. But right now we're doing surgeries. We did surgeries in February. We did another one in April. We're doing our next set of surgeries in August and then December.
Wonderful. Just wonderful. What a nice service.
It really is. And if you could see, if you go to our website, you can see the pictures and see the kids that we've helped transform their lives. It's truly amazing. And I've seen we've had some great stories here, great kids, families, and it just really makes you appreciate what we can do for people.
It's great.
And these families are so appreciative and they're so grateful because we get a lot from other countries, and they're just not getting good health care there, and they come here and they're getting everybody has just raved about University Hospital and their doctors because and the staff there, because everybody has just been so top notch. I can't speak highly enough of the surgeons and the staff there at University Hospital. They're the best.
It's wonderful. I've got to say, in a cycle of depressing news and whatever, this has been a very bright light to know this program exists.
Yes, and I think we can help military families as well. I mean, I know my dad was retired Air Force, so I'm a product of the military as well. But I know that you guys get TRICARE, and I know it's not always the best, and I really don't know how good they are at affording these kind of cosmetic and reconstructive surgeries. I don't know if they're more
Flexible.
yeah,
Flexible.
flexible or willing to do them. I don't know. I would love to talk to somebody. If anybody out there is listening that's from TRICARE, I would love to talk to you. But yeah, I don't know how
Well,
flexible they are with.
we also have many veterans who never retired from the military, so they're not covered by military health care. The VA provides care for them, but not necessarily the families. So
Exactly. Yeah.
there is a need. I mean, this is military city.
I
So
know. I've got to think there's people that are falling in the cracks here because they just don't know about any other options.
sure, that makes sense. Okay.
But we're here. We're looking for kids and young adults that we can help. And there's, I promise you, there is no strings attached. I know people are always going, well, there must be some kind of string attached to this. I promise you, there's no strings attached. One of our logo motto things is no family receives a bill and no family ever will. And we pride ourselves on that because that's what we do. We're here to just take that. It's just one little thing that we can do that might just totally change the scope of a kid's life.
Super. All right. Any other thoughts? Anything else we should add?
Um, if you have any questions, you have my contact information there. I'm here locally in San Antonio, so I'm available if anybody has any questions or need me to speak at any sort of engagement, things like that. I'm available. What else to tell you? We also accept donations, so I'm not I'm not going to forget to tell you that. And one thing I like to tell people about our organization is that every grant, every donated dollar, everything our main fundraisers we do in California, they have a big golf tournament and they have a gala. All that money goes to taking care, 100% goes to the kids. We have a whole separate fund that was given to us by a very nice woman that covers all of our overhead, pays my salary. But any kind of money that comes in for taking care of kids goes to taking care of kids.
Super. Super.
Yeah, I really like to brag about that because not a lot of nonprofits say that. But
Yeah.
and if you come in from other parts of the country, if you got somebody from, say, Michigan or South Dakota, we fly you in. We pay for that. We help put you up. We pay for food. We pay for all of that stuff. So you can come in here and not have to worry about that. You just worry about getting your kid taken care of and having a good surgery and good outcomes.
Amazing. How nice. All right. Special program, special person. Appreciate you very much being on our program today. The coalition will try to help get the word out too. What a worthwhile program.
Thank you so much for having me. And like I said, if anybody has any questions or comments, please give me a call or email me. I'm here and available.